When I first encountered the illness, I thought, this is the end of everything that matters to me. And so now what?
You just wish that it'd go away. And it isn't going to go away, and I know it's not going to go away.
I got to the point where I was really unable to run at all anymore. It's like, the best way to describe it is like running through mud.
I want to be able to move and be relaxed and loose, and my movements are awkward and stiff.
You feel different. Like it takes you longer to put your belt on, and it's, you kind of go, I don't do this as well as I did before.
A movement disorder is an abnormality of how we perform movements. So when we have less movements, we have what we call Parkinson's disease or Parkinsonian disorders. And when we have a lot of movements, we can have disorders like Huntington's disease, choreas.
Parkinson's disease has an array of symptoms. Most people recognize tremor as the most common feature, but it's by no means always there. Other patients experience slowness of movement, trouble with coordination and dexterity, and then there are a whole array of what we refer to as non-motor symptoms, but affect other parts of the body that affect quality of life, like bowel and bladder function, thinking, mood, anxiety.
Parkinson's disease is one of those disorders that truly represents the relationship between the mind and the body. A good example of that is how someone who has tremors, when they're feeling anxious, their tremors get a lot worse.
It impacts every facet of your life. You don't get an off day. You might have a great day one day, but then the next day might be tough, and it might be different symptoms on different days.
It is an incredibly complex disease, and it really is impossible for one person to address every aspect of it. It needs to be a team that works together.
Here at UCSD specifically, we have a team that includes a wide range of clinicians. So anything from urology to social work to neuropsychology to the physicians to the therapists, so speech and occupational and physical therapy. And we all meet once per week. So we are always discussing everybody on their caseload and really getting down to the problems.
There is tremendous interaction between folks doing clinical work and folks doing more basic science. And now we have 4 programs that are on phase 1 clinical trials. We started from the patient, then that helped us to inform how to do experiment in the lab, then that helped us to develop new drugs or new treatments, and now those treatments are going back to the patient.
They really have coalesced into a team that can deliver the best care for patients with Parkinson's. I would definitely put the UCSD Center among the leading NPF centers of excellence.
I think it is incredibly exciting how science is advancing to provide the best care possible. So now that we can do it, why not do it and get the pleasure of getting advances, improvements in the field of movement disorders in research, as well as seeing our patients doing great. It is phenomenal for any of us to see how a patient that comes with multiple problems, motor, cognitive, autonomic system, and completely in despair, we have the feeling that we're gonna be able to make them so much better in a short period of time, and then see that.
We can use the system here that works so well as a model for recreating this at other places in the UC system, as other places in the country. So this is a place that works. These are people who know what they're doing. These are systems that have been tried and work.
We are very dependent on individuals who are willing to help and partner with us in terms of providing donations. We have the infrastructure, we just need the funding that could help us, not only in terms of the research we're doing, improving the clinical work that we're doing, but also in terms of training the next generation.
We want to make sure that we develop the leaders of tomorrow in movement disorders.
Not only in terms of neurologists, but neuropsychologists, physical therapists, occupational therapists, speech therapists, psychiatrists, and so forth, so that we can really be able to say, this is what UCSD has offered to the Parkinson's community.
So this is a highly, highly important contribution to healthcare delivery in this area.
It's not about just getting better. It's about getting better, but maintaining and just living your life.
I was diagnosed 3.5 years ago in December of 2011. Once I started on medication and got the regimen under control, I was a completely new person.
I feel like I can do as much as I can do, and that I'm willing to try and to do that stuff, and there's a reason to do that because it's there. And you know, it is scary. I mean, there's no sense of pretending that it's not. It is. On the other hand, it's not gonna win.